What's the story about chargemasters and where do we go from here? Chargemasters have several names. Hospital chargemaster, chargemasters, CDM, which is charge description master. These names refer to a file listing of a hospital's charges for all the things. Well, all the things means the hospital's list of billable items. What's billable? Well, billable means that they are able to bill a patient or a health insurance provider for the item. But just because they bill someone doesn't mean they'll get paid that amount. So, this is where the chargemaster gets tricky. It's unlikely that any two hospitals will have the same chargemaster. See, these chargemaster lists were created many years ago when insurance companies came into the healthcare picture. Insurance companies want a discount because they buy in bulk, and the hospitals don't care to give too great a discount. So this crafty little process started. Before the hospitals went to make deals with insurance companies, they would just raise the prices on all the things so that they could turn around and take a cut in payment from the insurance companies. After time, this process gets complicated. You have all these different hospitals making deals with all these different insurance companies, and it's all confidential. Then there's those government programs called Medicare and Medicaid, and they have amazingly different payment amounts from the billable amounts on the chargemasters. Fast forward 30 plus years and you end up with markups 300 and 400 times greater on these chargemaster lists than what the Medicare rates of payment are. Does this matter? After all, the common answer has always been that chargemaster data isn't real, that no one pays those amounts. Then why have them? But wait, what about the folks without insurance? What price do they pay? What happens when I have private insurance, but I have to use an out-of-network hospital? What happens when I reach the limit of what a patient's cost should be? Good questions. Unfortunately, they don't have simple answers. Here's a quick picture of what it looks like overall. The higher the billable prices on these chargemasters, the higher the amount of the actual bills. With no discounts from having insurance companies bargain for you, or being out of network, these chargemaster prices matter. The higher the chargemaster prices, the more likely total patient costs will exceed their normal limits. This means they will become outliers. They lie outside of the normal patient range of cost, and the hospital gets paid more because of this. So let's just do this again. Raise the prices on the chargemaster, make an agreement about what it should cost with an insurance provider, and then more patients become outliers and the prices for out-of-network providers and uninsured increase. Now, with the Affordable Care Act, a push is happening for price transparency. That means that patients get a more clear picture of what their billable items cost. This may help them to choose a hospital based on this information, along with safety and quality measures. Now, this is only a general overview. This gets way more complicated, but it's a start to understanding. To recap, chargemaster equals price for billable items per hospital. Is it worth having so many, or could we make a lower priced universal one closer to the Medicare payment rates? Would it hurt anything for this to happen? Good questions to think about. Chargemaster in a nutshell.